Now, in terms of announcements, I'm very pleased today to confirm that we have placed an order for a further 166 million rapid antigen tests. As you know, we had already ordered 44 million and had seen significant early deliveries arrive. 3 million I reported on last week. We've had another series of deliveries totalling 4.5 million this week. That makes all sorts of things possible, and we'll have more to say about the way these tests will be deployed and the environments in which they'll operate in coming days. Indeed, National Cabinet will be talking about some of these issues today. It's very important that we keep adding to that stockpile. They're going to be relevant, they're going to be particularly important in the weeks and months to come. And just like every other state in the country, I assume, and every other country around the world, we're out there in the international market and indeed some local market, pushing as hard as we can to get as many of these as we can, as quickly as we can. We had a couple of flights this week that did not land on the basis, didn't take off and didn't obviously arrive on the basis of the ash cloud. So you know, there are many challenges, many and varied challenges to continue to build to these stockpiles, but we're very confident that we'll be able to do so. And of course, there is that 10 million, 2.5 million which will come to Victoria out of the national medical stockpile as well. This is a very significant order that we've placed, among the largest I expect across the country. We've already distributed, by the end of this week, we will have already distributed more than 2.2 million rapid tests to our health workers, staff in sensitive settings, as you'd expect, and also vulnerable communities. That includes more than 50 community organisations that I spoke to you about a few days ago, them having a rapid test supply, using those proven and trusted networks, allowing them to reach out and provide the best service and care to their communities. That takes pressure off so many other systems and delivers much better outcomes, particularly for those who have underlying vulnerable circumstances. That vulnerability is best dealt with at a local, trusted, most personal way possible. We saw right through last year and the year before, multicultural communities, multi-faith communities, real community leaders stepping up, playing such important roles. And again, I thank them for their true and genuine leadership at the most difficult of times. We are delivering millions of these rapid antigen tests across the state. So many of our testing sites have RATs available for those who need a rapid antigen test. We are handing out literally hundreds of thousands of these. And Jerome may be able to speak in more detail about some of the trends in recent days, but I'm very pleased to think that there are, on any given day, 40, 50, 60,000 people, perhaps more even, who are getting a rapid antigen test free from a testing hub. That's about cutting off chains of transmission. When you combine that with people isolating, making that sacrifice, making that important contribution, that's how we limit or at least impact the number of cases that we have across the community. And what we know is a percentage of the total number of cases will finish up in hospital. So if we have less total cases, we finish up with less people putting pressure on our health system through no fault of their own. That's just the way this works. We don't have as many people in ICU as you might have expected if this was a Delta outbreak that had got away this much. That's the nature of this new variant. Not mild, but milder than Delta. The vaccines are still working as a protection against critical illness in the vast majority of cases. That's great news. But infectivity, the attack rate of this, the transmission rate of this virus, this new Omicron variant is so high that the only thing we can do is get a third dose. We call it a booster. It's not really a booster. It's certainly not a bonus. It's critically important. 3 doses is what is needed. And then, of course, to isolate, play your part when you're called upon to do that. We're grateful, it's so important, and it is making a big difference. As we see some stability come to these numbers in recent weeks. Now, I just wanted to speak briefly in relation to announcements that the Acting Minister for Health has made today. We spoke about IVF services yesterday, and I made it very clear to you that no one's pleased to have to turn off or pause any services across our health system. But Co-Brown and the extraordinary and unique pressure that our system is under, and again I stress that's not because of money or the lack of machines we need or PPE or equipment, it's about people. And when you have literally 4,000, 5,000, 6,000 people who on any given day would be working in our health system but aren't because of COVID, that puts extraordinary pressure. So decisions were made based on advice. It's now appropriate to have another look in the context of things as they are unfolding, to kind of start with a worst case position and then try and reinstate whatever you can. I'm very pleased that the public health team, the Chief Health Officer, has reviewed his advice and the Minister's accepted that and been able to make a new decision under the new Act to reinstate IVF services. That'll take a couple of days, but those who are already in the system were still receiving mid-cycle, for instance, they were still receiving IVF services. It was about not having new patients come into that system. They'll be able to come into that system from early next week, and the orders will be effective immediately, and that is a very good outcome. I apologise for any distress, for any concern. It's never easy. It's never easy in such challenging times, and I just want everyone to know across the community, everyone's doing their very best just to keep people safe. That's what drives us. That's what everyone who's providing advice to the government is driven by, one thing and one thing only: to try and do everything they can to keep Victorians safe. But I do apologise for any sense of distress or pain out of this, but it's great to be able to have those services back on. And I thank the public health team for reviewing their advice, for changing their advice, and of course for the Acting Minister for Health for having made the decision he's made.